Hi, welcome to my channel. Welcome to Ife's Space. Well, today's topic, I might be stuttering quite a bit, but when I say I'm recovering from a very long week of, will I say, pains and all of that, and I just thought, okay, I think this would be a good time to talk about the healthcare system in Malta. Like, as at last week, my face was this swollen, it was really bad. Malta offers like a comprehensive healthcare system, right? I think, and very good, robust healthcare system, to be very honest. I think in the whole world, according to WHO, World Health Organization, I think Malta is ranked quite highly. I think 18th or 19th in the world, if I am not mistaken. Their healthcare system is quite good. First of all, I'll be talking about the public healthcare system. We have one major hospital in Malta, which is Mater Dei Hospital. I know that this hospital is quite new. It was not too long ago that this hospital was built. Public healthcare system in Malta is free. Actually, generally it is free. If you work in Malta as well, you would have access to free healthcare. However, at the time that you are visiting the hospital, you need to present your pay slip, otherwise you will be charged. The pay slip, obviously, to show the social security that you've paid over time and your tax as well. Oh no, I think it's social security that takes care of healthcare. So far you produce your pay slip, you would not be charged. Public healthcare system in Malta is fine, really cool. It covers visits to the GP, you are seeing a specialist, you're going for scans, like all encompassing really. Yeah, it is quite robust. Even dental appointments, optician, you want to say the optician. It's just that for cases like dental, optician, you want to see the optician, or gynecology and the likes, all those will be based off how urgent it is, right? Because trust me, there's quite a long queue when it comes to these things in Malta. Like, they can keep. I remember one time we all went as a family to the clinic to just do general checkup, and we wanted my children to also see the dentist, and they were giving them, I think, 1 or 2 years appointment, no, 1 year appointment. I'm like, wow, thank God it's not like it's an emergency, so we would have waited that long. However, all these are covered, and then also, even in terms of attending to you, it is only when it's an emergency that, I mean, you might not wait so long. But even in emergency, I've heard of people who would wait a long, really long, because it depends on how, I mean, life threatening it is. If it's not an emergency, you might have to really wait a long while. From hospital stays, scans, seeing the GP, seeing different specialists, like different specialists. Even some medications are actually covered as well. There are some things that they'll give you depending on your situation. It could be that, okay, maybe you have heart problems. Maybe this was detected during your random check. They would, assign you to a specialist, or it could be diabetes, it could be weight or blood, I mean, all these illnesses, right? So they actually do provide. In fact, I even heard that for diabetes, they give you some sort of is it machine they call it now, that would you and it's free of, I mean, you don't pay for that. They even give you like medication every now and then, to support, I mean, free of charge. For public health care, we have the polyclinics. These are government, I mean, run by the government as well. So each locality will have a clinic in the area, and then Mater Dei is the general hospital, is the main one. We have just one of that. But I mean, the very first time we wanted to do like a general checkup, we all went to the polyclinic in our area, and it was quite good. I mean, it was quite a good service. We ran blood tests and everything. I mean, it was really good. Then we also needed our children to see like a specialist, like a pediatrician, like check their teeth. Also for, I mean, dentist care, what's the word? Optician, optical care. I mean, we just wanted general checkup for everybody, and it started from the polyclinic. At the polyclinic, you do not need to present your pay slip. Just your residence permit is fine, actually. Secondly, I'll be talking about the private healthcare. So obviously, I've explained how the public healthcare system works. For the private healthcare system, we have quite a number of hospitals and clinics. I know there's St. James and Thomas. There are quite a few, and there are some private doctors as well. I mean, private GPs that you could register with and just have them as your, let's say, personal doctor. I don't know any though, but I know that there are quite a number of private hospitals and dental clinics, eye clinics, and the likes. Okay, usually to access this, you need, because they can be quite expensive. Okay, however, quite a number of people do use the private hospitals, especially if you want to avoid long wait times and all. Especially if yeah, you pay, like I had pain like toothache for the longest, and there was no way I would go to Malta Day to start waiting on the case. So it was a private dentist close by that I went to. If you are seeing a specialist as well, oh my god, you would pay a lot. Like I think it's about 60-70 euros to see a specialist. Then to see a GP, I think it's about 20, 25 or 30 euros. I can't remember now. Okay, if you're just coming to Malta and you want to do like the usual chest x-rays and health checks, you need to go to a private hospital. Trust me, Malta has a way of trying to, let's say, generate funds for their people. I mean, you have to pay for that. Even though you have a private insurance, that would not be covered at all. Also, as an expat living in Malta, not even just expat, even as a student living in Malta, you are required to have a private health insurance to secure your permit, your residence permit. I know that for students, because I've had quite a number of students who have come in, and I know that the range is around, I think it's about 120, 150 euros per year. But I think that's for like the most basic plan, because obviously depending on the kind of plan you have, you might not have access to a lot of things, right? So, but this is a prerequisite if you are planning on applying for your residence permit. Okay, so the third point I would like to talk about is pharmacies and medications, right? So in Malta, and I think that's the same case that will apply to some other countries, right? You cannot just go to the hospital, and there are some I used to call them drugs, but I've come to realize that no, drugs isn't the word, it's medication. There's some medication that you can just freely buy over the counter, but there are quite a number that you would need a doctor's prescription for. That was what I got to learn recently, right? When I was having like serious pains, right? So it's not just the random, if it's a paracetamol, for example, yes, they might give you over the counter. Even paracetamol, I think there's some, I don't know, I'm not too sure, but there are some serious painkillers and antibiotics and the likes that you actually need a doctor's prescription for. And there are some, I think it's not, there are some medications that even though you have a prescription from abroad, from your home country, you would still need the prescription from a Maltese doctor. I know that the pharmacies in Malta are well stocked, like they have, I don't think there's anything they really do not have, right? And I don't know, I've really not compared pricing before. No, I have actually. I remember once when I wanted to get a medication in the UK, and I compared the price. I was like, wow, this is really expensive, and I ended up not buying it from the UK. So I would say the prices are fair. I think for every outpatient, I mean, so far, outpatient meaning you're not admitted in the hospital, medications will never be covered, even though it's a government, I mean, it's a public health care. The best it can do for you is write a prescription, right? But in the event that one is admitted in the hospital, as far as I know, I think whatever medication you'll be taking at that time is covered. To conclude this video, I would really like to advise everyone, please, you need to check. I mean, you need to be very, very intentional about your health. Like, I really don't know, like, this video is really coinciding with something that happened today as well. So today, like I mentioned, we are in a town in Norway, and we decided to experience their public transportation. We're on the bus, we're just seeing around the city and all of that. And at a particular bus stop, a woman who was just standing, just slumped, but she fell, and how nice and pleasant of the people in the bus, like they had to like alert the driver, like, oh, there's someone outside, I mean, who was standing outside that fell, a black woman. I can't really tell where she's from, if she's Nigerian or if she's from one African country, but from the look of her face, I could tell that she was stressed. Thank God they kind of revived that. I know that a lot of us, we are seeking the greener pastures, we're looking for a better life, we want to work so hard to send money back home, but we need to check our health. We need to take it slowly. I've heard of a lot of people, even in Malta, UK, different countries that work from one shift to the other. There's no even breather at all. Like, we need to all rest. Like, it is so important. I'm so glad that this woman did not, because I've heard of a situation where someone just passed on that way. It was so obvious that she was so stressed, and they helped her into the bus, and so I think she stopped at the clinic. I'm not even sure, but it was really, really surprising. Like, she was just standing and she just fell, and I mean, people had to come around to help out. Yes, I know that we want to work and work hard, but we need to be very careful. We need to take our health seriously. It doesn't cost you anything. Yeah, it might cost you a bit, but if you have insurance, health insurance, or if you even work, I mean, I believe that if you are working around the clock, then you should be paying social security, so you should have access to free health care. So just go to the hospital, except if you are working illegally and you yourself will not want to present yourself at the clinic or hospital for them to check you. But just go to the hospital, please. Your health is more important than anything else. It's only one who is alive that can actually take care of family back home, or take care of, I don't know if I'm making any sense. So please just go to the hospital or go to a clinic near you. Just tell them, see, that was what we did in our family. All along, I've been here for, this is our 7th year now, and not for once have we said, okay, you know what, let us go to the hospital. But it was just last year we said, see, we have access to free health care. Why can't we just go to the hospital and, just tell them that we want to do a general checkup? And thank God we did. Prevention is better than cure. The sicknesses will not show right on your face. Like, it will just start, you might not even see any signs, to be honest. And then you just feel you're fine. Oh, so far you're not sick. All is fine with you. Then you're good to go. But I've really realized that a lot of people from our part of the world, we work too hard. We work around the clock. We hardly have time to rest. Let's not even say, okay, at least go on vacation, go and rest. You can sleep. I mean, you have the right amount of sleep, rest well, visit the clinic, do a proper general checkup. That's where they will check everything: your heart, your liver, your kidney, your blood sugar, any trace of high blood. Like, all these things are really, really important. It's really important. Like, I remember the very first time I went to the hospital, we just said, oh, let's just go do general checkup. I mean, it's a testimony now. I just thank God. But the way the doctor was just running around, I'm like, what's going on? I walked in here myself, and there was nothing wrong with me, But they're just panicking because I think for some reason they saw that my blood pressure was a little bit high. I really never had any issue with high blood level or whatever it is. But then again, that was like a wake-up call, like, okay. I remember then, because I was also battling with serious pain last year as well on my toothache. I could not sleep like 3 nights back to back. So that kind of triggered the blood. But I didn't know that it was going to have anything to do with that. Of course, they saw me, they're like, oh, really running around, checking to be sure there are no other. Like, if you see the kind of checks these people did, I was so impressed. I was like, wow, these people are so thorough. This was just at the clinic. Do you understand? They're like, I don't know, maybe those are things that they check if one is having is it hyper, no, not hypertension, like high blood pressure or heart issues. Like, they're checking everything. They'll push my they'll push my face to see if I will stay still, push my body, my leg. Like, what did they not test? I said, God, what are you guys looking for? Do you understand? Do you know how many specialists they booked me to see? I saw quite a number of people, and thank God that all was fine. But what I'm trying to say is that it is better to be safe than to be sorry. It is safe. Like, we didn't pay a dime. And how it is that once you visit the clinic, they'll create an account for you under your ID card. So we all have our individual accounts. Here you can also always log on with your ID number, right? And check, maybe if you want to check past test results, you can check to see what it is, what it was, check your different results. If you have an appointment, you also see it on that portal. Very, very good portal. It's called myhealth.gov.mt. This is from the government angle now. Like I said, I feel that the government hospitals are way. Have I had experience with private hospital? Yeah, I have had, when I needed to say specialist, yes. But I would say that my experience at the government hospitals has been way more thorough than that of the private hospital, to be honest. Like, I feel like, I don't know, maybe these people are just extremely experienced, and obviously they take their time. But I feel that with the private hospitals, like, I don't know, it's almost as if they're always in a rush. Just want to rush, and maybe they have a time, so I really don't know. But government hospitals, they're so, like, they would rather spend 1 hour with you and be sure that, okay, yes, you are good. It's been very, very good. I would really, really encourage everyone, just go and do a general checkup. It would not hurt you. You know, it could be your off day. Just go and do that general checkup. It is so important, guys. I don't know why I'm saying this, but I think what I saw today really triggered me, and I was checking Instagram recently. I saw that someone in UK just died like that. Like, come on, just go check, and please rest well. Rest really well. See, it is, I can't even overemphasize this. Rest really well. Private hospitals are like this toothache, for example, that I've had for 2 weeks. Yeah, it's been like, oh, for 2 weeks. I went to a private dentist, and I was referred to a private surgeon. So all of this we had to pay. Eventually, would make claims back and all, but it was pretty much private health care. I mean, a private dentist that we used, and it's been it's also good, but I just kind of feel that I feel like these private clinics are just out to make money, in my opinion. I might be wrong. With the government scheme, you have access to dental care, even scaling and polishing as well, free. I hope this video was very helpful, and I mean, if you have any questions regarding this, do reach out to me, and I'll be glad to answer. Okay, check your health, rest well, sleep well, avail yourself of all the numerous benefits and opportunities you have as a result of living in Malta. There are a lot of benefits. I've heard of how much this costs in different countries, really high. If you've seen a specialist, a GP or whatever, it's so high. So thank you very much for watching once again, and do have a great, enjoy the rest of your day or evening or night or whatever it is. Bye.